good evening, good morning, good afternoon, whenever you are. Today's another day. It's on a Sunday, and yeah, pulling off. Anyway, I don't know why vehicles make that sound kind of weird. Anyways, today's Sunday, and I'm heading back to DC. And at the moment, I'm in Virginia, so I've already left the state of North Carolina, and I'm currently in Virginia. So I stopped nearby to get a break because I was sleeping on my way here, and for safety and for the safety of everyone else on the road, I have to stop and take a break. Needed some break. So as I'm taking this break, it's the moment to make a video, because I don't know, by the time I get to DC, it might be darker. So today's video is going to be about the Medicare, and I know I touched on this previously, but I think we need to find a solution to fix the Medicare system, right? Many people getting sick. Yesterday I mentioned about how, areas like North Carolina, where they have very cheap gas, cheap rent, right? But there is negative outcomes, right? With cheap things comes with no taxes, I guess, and then that means there is not enough Medicare to treat people. People are getting sick. So I just spoke to some people, watched some stories, and we need to find a ways of at least helping people. Maybe not entirely pay full coverage, but trying to have some subsidies. U.S. healthcare or the U.S. medical system is very expensive. Some people may not be familiar with the medical system here in the United States. The quality of the education, the quality of medical service is pretty good. It's like A+, right? But all that comes with very expensive modern equipment, modern infrastructure, well-educated doctors. But the people who tend to get sick are the people who don't have the means to afford those high-level infrastructure. So mostly it's children and elderly folks. So the U.S. government has been discussing about ways of helping people get the medical they need without compromising or without increasing taxes. So as I was driving back to DC, I thought about it, how the medical system in the USA is very sort of harder, sort of not that easy to fix, as like right now, the U.S. government passed the budget, the federal budget, and they reduced the amount of money going into medical system to help patients get treated. So I don't know. Personally, I don't really have an expert in the medical field. I don't have an expert in advocacy. I'm not an advocate. I'm a person who comes from finance background, happy to use the economics and mathematics to solve problems, but I really never had an experience. But there are hundreds of people in the USA, like a lot of people in the USA who are sick, that they need to have their medical situation get fixed. So this video is to remind me, maybe someday I might try to get a job someday, trying to find a better ways of working in the field where I can maybe think about the people who live in the rural areas like in North Carolina, because cities like states like California, DC, New York City, they have done somehow a great job in terms of subsidizing the medical field. They have tried to take a portion of tax people pay and then help these people who didn't help. Then they have put the pressure on employers to ensure that they can ensure the employees, so if they get sick they have medical coverage available. But most states, or almost all of them in the south, starting from North Carolina all the way to, like, I don't know, Florida, Texas, they don't really enforce the idea of Medicare. They don't give their employees medical coverages, and when they get sick they have to carry on and they have to deal with the medical bills. So something I feel like I need to do today, something I feel like it is needed. We have folks here working, right? They're trying to make a living, trying to have a good life. These people around us, they are working, they are making money, they are taking care of their families. You have truck drivers, warehouse employees, you have financial advisor, teachers, right? All these people, farmers, all these people, they need quality medical care, but the key is how can we afford them, right? And I have looked into the expenses of the medical system. It's just that it's very expensive to develop new medicine. It's expensive to train doctors who could potentially treat very tough disease, like cancer and diabetics and blood pressure, and all this money is expensive. So it's kind of makes sense why you go to hospital and then you have a large amount of bill. It makes sense why employers, they trying to think, okay, is it really economical if we have to pay an employee certain amount of money, and then we have to pay for their medical coverages? So I don't know, maybe we need to create some sort of a monopoly, have corporations. I think if companies can come together and form, buy medical insurance in a bulk, right, they can minimize the expense for the employees. I think it's better if the federal government can encourage all companies in the United States to have a universal health care, like something universal where companies can contribute. Think about it. Think of like a gym, right? A gym, you pay membership, but you don't go every day. But there's someone who wants to build a muscle, someone who wants to lose weight. All these people pay the same amount of money in the gym, but someone else pays $100, but they don't go as much. Someone else pays $100, they go every single day. But the gym doesn't cost more money for the people who go every day, because they can easily subtract from the other person who pays more and doesn't go every day, put into the other person who pays more. So I feel like we can do the same thing for Medicare. We can have people who don't get sick as much. So if I have to pay 3% of my taxes go to Medicare, and then everyone else does the same thing across the country, then the people who are, when I get sick, they can easily be taken care of by subsidizing some of the money that I'm paying that doesn't need to go into that I don't have to use. And of course we can do other things. A lot of things that happens in America can be fixed without paying any money. For instance, we can build communities that have easy walkable. We can clean our communities, clean our cities, where when people live in a dirty area, they can easily get sick, and that costs money. We can decrease stress from people, and by having communities like cities and states and counties can organize a monthly community. People can come together, share ideas, contribute, so that will reduce the stress. You can also encourage people to work out. So like these commercials I saw on the internet, they be having people who are like overweight, you know. I know it sounds bad, but we need to normalize the idea of having people to go outside, to walk, see the communities, and you know, all these things can minimize the you know, the cost, the overall cost of Medicare. Jobs should have a gym. Amazon is doing that. Amazon is having some sort of gym or workout area. Jobs should do the same thing. Companies should do the same thing. Churches should do something. Like imagine a lot of people go to church in the United States. I really don't. I will make a video one day, a separate video from this. But if we want to fix things in America, we need two things. We need to target churches. We need to target schools. Schools are really doing great. The average person who goes to school in the US, in college, they are more likely to be less sick, and they are more likely to have a good paying job. They are more likely to have a better life. But people who don't go to school, or who didn't go to school at all, they do go to church. It's like the second options. So we need to target churches. Churches need to focus on ensuring that people can walk, people can exercise, people can have health insurance, right? Like we need to have churches need to normalize that. So these are the areas to target, ensuring that everybody is you know, is it fit, is it healthy. That will minimize the cost of healthcare in the USA. But you know, my understanding is that, you know, I feel like companies that are selling insurance, they do it on purpose by building communities that are not, by collaborating with the developers, and then they build homes and apartments that are not workable. And they do this because they know that people who want to stay fit, who wants to be healthy, they will move into the rich area where it's workable, and those who don't have enough money, they will move into the area that is not workable. So we need to stop using human lives for money, for monetary gains. And I think companies are doing that on purpose, right? So cities, communities needs to focus more on having each and every person, regardless if they are poor or rich, need to ensure that they are encouraged to take care of themselves. You know, basically minimize the amount of volume that goes to the hospital. Minimize when people are healthy, when people are not sick, they work and make money. I'm from Uganda, so I understand when people are sick, the economy goes down. So we need to focus on ensuring that people don't get sick as much, right? It's what, you know, it's what we need to focus on. Whether we debate on policy in the Washington DC, we need to think about the smaller things, you know, small things like taking care of oneself and all that. So that's the videos of today. It's enough 15 minutes, and I hope that I drive home safe. And if you see me tomorrow on a Monday, that means I made it home safe. And these videos will be here and they'll be watched. And as you can see, I'm very tired. I need to sleep. I was sleeping when I was driving, so I need to take a nap right now after this video and get some food or some drink. Since yesterday I haven't saved as much because I've been driving back and forth here in North Carolina. People in North Carolina, they live in that's the problem of living in areas of North Carolina. In California, it's expensive, yes, but people live close to each other, right? Like you don't have to commute 3, 4, 5 hours from each other. Here in North Carolina, you have people living like 2 hours ahead from each other, 2 hours from each other. Like it's very spread out. But anyways, it's relevant. Again, if you find this video very helpful, please let me know. Give me a follow. I'm in Virginia. If I go to DC, I will make another video with the same series, which is government policies, legislature, as well as the economics of the USA. Again, today I don't feel it, so very short video, nothing much. Take care. Thank you so much. Bye bye.